Hello everyone, myself Ranjan Kumar. I am physiotherapy student. So in the series of exercise therapy, we are taking one new topic which is goniometer. It is essential for our physiotherapy. So what is goniometers? Goniometer is an instrument like that. It is a half 180 degree goniometer which can use for the measurement of range of motion. So introduction of the goniometer. So the instrument which are used for measuring the range of motion of the joint is called as goniometer. So it's basically used for the range of motion. What is the exactly range are present in our body? It will be like appropriate at the level or not. Like if you are measuring the elbow flexion, so it is 0 to 140 degree is available or not for measuring like that. So the term goniometer is derived from the Greek word which is gonio means angle, metron means measurement. So this is a goniometer diagram. You can write in university examination for the full marks. And what is the prequosite? It means what we can perform on the patient like elbow flexion. So what was the criteria we have remembered to performing before the performing on the patient. So the measures of the range of motion of a particular joint, the therapist should have the true knowledge of the range of motion of individual joint. Each and every joint, therapist must know aware about the how much the range is going on that joint. The type of range of motion, what kind of joint a type, like flexion, extension, rotation, inversion, eversion, plantar flexion, dorsiflexion. Osteokinematics, like which joint is moved, orthokinematics, which bone is moved, which bone is stable, and axis and plane of the joint. It means which plane and axis the joint is movement, like coronal axis, sagittal plane, horizontal plane, vertical axis. So this is prerequisite to remember the therapist before performing the range of motion on the patient. So what is the types of goniometer? So basically there is 4 types, but we are consider only one goniometer, which is universal goniometer. It is like widely acceptable. So there is a 4 universal goniometer, gravity dependent goniometer or fluid goniometer, pendulum goniometer, and electrogoniometer. So what is first universal goniometer? It is designed by Mr. Murray. So Mr. Murray, and it is the most widely acceptable and recommended instrument to the measuring range of motion. So that is they're invented by the Mr. Murray and widely acceptable for the measuring the any kind of range of motion without any kind of like interruption. So it consists of stationary arm and movable arm and the body. So this is a stationary arm, this is movable arm, and this is the body, half body 180 degree, and this is the fulcrum. It is the joint of the body. So now we can go each and every part of the goniometer detail. So what is body? Body is there, also called the protractor. So it resembles like half and full moon circle protractor. So this is half moon. Normally the half circle protractor contains 0 to 180 degree. Here you can see 0 to 180 degree are present. The body consists 0 to 360 degree readings. It is a whole circumole which is present to also available in goniometer. So it can measure like 360 movable degree of our like head rotation and like circumduction of joint like that. So the middle of the body axis and fulcrum screw is present, which is also called vertex. This is a screw also called fulcrum or the vertex, which is present in our the joint where we can like a measuring of the joint range of motion. So the axis of the goniometer placed over the axis of the joint which has to be measured. Like the axis of the joint, like we can measure like flexion extension. So here I can see like medial ulnar deviation. So fulcrum is present upper to the wrist joint and in between, and movable arm is to be middle phalanges or middle first, second, third metacarpal, and the stationary arm present inside in the interossseous membrane between the ulna and radius. So for measuring the ulnar deviation and the radial deviation. So that is the axis of goniometer and the measuring of the any kind of joint movement. So what is function of the stable arm? So this is stable arm. So this is the extension for the body of the goniometer. The stable arm doesn't have any motion. So stable arm doesn't any kind of motion. They are stable towards the stable bone, and it will be aligned with the proximal segment to the measuring joint. Like that you can see this is a stable arm, and this is to proximal towards the body, and this is movable arm, it is a distal towards the body. So here you can see written here. So movable arm, this is the additional attachment of the body, the goniometer of the axis. Movable arm is aligned with the distal segment of the measuring joint. So here it is a movable arm, so it is a distal part of the joint, so we can measure the ulnar deviation and radial deviation of the joint. So next is our fluid goniometer. So it is also called a pelvic inclinometer of the gravity dependent goniometer. So basically it is a fluid goniometer like a pendulum like, so it can be measured on under the water. So what is exactly range of motion is happening into the fluid goniometer. So it can be not widely used and acceptable. So it is designed by the Senker in 1956. It is a having gravity affected pointer and the fluid filled chamber with the air bubbles. It resembles like the, so in fluid goniometer have affecting pointer and the fluid filled chamber which have air bubbles. It resemble like the carpenter's level meter. So what is that meaning? There is in goniometer they have as a carpenter meter. If someone have like a pelvic tiltation and foot drop, so they can help to resist gravity. So if can do without gravity movement to check the range of motion, so we can help the fluid goniometer. So what exactly range are occur? So in prognosis period of the post fracture patient, if I do activity like exercise in like hydrotherapy doing in water, so we can take a fluid goniometer to check the range. So there is a carpenter level to identify what is the exactly range are occur in the patient. So it is mostly used for measuring the pelvic tilt or drop. So what is exactly like that I told you. So what is the pendular goniometer? So pendular goniometer designed by Fox and Wang, remaining in 1934. It consists of 360-degree protractor with the weight pointer. So basically pendular goniometer is a weight dependent goniometer. Just like that, if you have like a weight on a hand, so if you have neutralized, so they can tell about us the like digitally way what is exactly range. So it is not like worldwide acceptable. So it is like some small joints and like that are using this pendular goniometer. What is another electrogonimeter? So it is a digital goniometer designed by Krepkovich in 1959. Two arms. There is have two arms. One is attached with the proximal segment and another is attached with the distal segment, just like the universal goniometer, measuring the joint movement. So it is digitally like identify and like so that what is exactly range of motion is happening in our joint. So the potentiometer is connected with two arms. Changes in the joint position show the angulation on the potentiometer. So if you are change and repeat like joints, so there is a like fulcrum are there. So there is no fulcrum on the electrogoniometer. So I'll put on here and the movable arm in this place with the third metacarpal joint and the stationary arm between the interosseous membrane, radius and ulna. So they can like you can move the movable arm, so they can like digitally way they can understand and so about the number of the joint which how much degree the movement are we occur. So that is the electrogoniometer. It is mostly used for the research purposes. If they have lots of kind of contracture develop in the body, so that is the research purposes they can use this electrogoniometer. So now we come the procedure of the goniometer, where you can have it write in university examination for the good marks. The patient clothes are removed where the joint measurement to be taken. If we are measuring the elbow joint, so know about first sure about that the cloth or the elbow joint will be removed, because the actual range will be not occur if the tightened cloth will they will be wear. So position of the patient will be relaxed manner and the joint is to be measured should be the free from of the obstruction like pillow and couch. Don't use the pillow and couch of the patient for the relaxation, but make sure the patient are in the like supine position or they can in relaxed position, but don't use the pillow and couch. So measuring joint has to be in the 0-degree position. So before the starting the measuring of range of motion, first we can take the 0-degree for the starting position. Total procedure should be explained to the patient before doing any range of motion activity. Explain each and everything to the patient. Therapist has to be stand near to the patient and facing the joint which has to be measured. Like that, if you are measuring the elbow joint, so you can stand like nearby the joint. You can't do the opposite side and you can measure the joint. No, it couldn't happen. It can be a wrong measurement or occur if you are doing that. So axis of the fulcrum of the goniometer is placed over the axis of the joint to be measured. If axis of the goniometer, this is the axis, this axis is also present between the joint axis, there you have to measurement of the like that medial and radial deviation of the wrist joint. So next is stable arm is fixed and the proximal segment of the joint. So stable arm is always fixed, as you can know where you can see in the video, and the movable arms is fixed with the distal segment, and movable arm is fixed with the distal segment. They can move, they can also move with the joint. Therapist has to move the distal segment of the joint with the movable arm of the goniometer to measure the joint range. Therapist must move this movable arm with the third metacarpal if you are measuring ulnar and radial deviation. So movable arm moved to with the third metacarpal. Make sure. So what is the factor affecting range of motion? What kind of factors they are affect the range of motion? There are some. like soft tissue tightness. So what is the soft tissue tightness? Like muscle, ligament, capsule tightness, cartilage tightness, and synovial membrane tightness, spasm and tightness cause the reduction of range of motion. So that is the soft tissue tightness. This and may occur due to the prolonged immobilization of joint. Like there is some post fracture, they have some plaster of Paris are on the hand, so they can't move the long duration of the duration of their joint. So they can have developed the contractures or immobilization. So injury around the joint, any joint disease like osteoarthritis, rheumatoid arthritis, and ankylosis, spondylosis, and tibial arthritis. They are suffering from like rheumatoid arthritis occur in small joint, osteoarthritis, inflammation in on joint, and they can swell down and they can't move. Prolonged period, they can range of the motion will be reduced. And the TB arthritis, also the tuberculosis bacterium occur in the joint. They can also don't move the joint. They can in a long period, so they can occur immobilization in this joint. Adhesion formation. So what is adhesion formation? Lack of mobility joints lead to reduction of the flexibility and nourishment of circulation around the structure. Like if they can't move on a long duration or period of this joint, they can like implementation of the nutrition deficiency on this joint and the reduction of the like blood circulation and oxygen supply on their joint. So like adhesion formation occur, and the flexibility of loosen on that place, the elasticity of loosen on this joint. Injury and inflammation around the joint, like different kind of inflammation, like fracture. So inflammation will be occur, injury will be occur. So they can't move. They can like reduction of the range of motion. And any recent injuries like disease like osteoarthritis, rheumatoid arthritis, ankylosis, like that disease. So muscle bulk. There is a muscle bulk in healthy person. So I can like difficult to measure out what actually range are present in their body. So if I have to be must and like experienced therapist can like knowledge about that to how I can measure the actual range of motion in the healthy person. So flexion of the elbow is 135 degree, but the bodybuilders, due to have their huge biceps muscle work, they have to reduction is 130 or 125 will be occur in our in their body of the not a patient in a bodybuilder. So it will be reduced due to the muscle tightness, the muscle bulks. We can't measure about that. Gender. Also, the females have the less hip extension by their hip, and flexion is to be 20 years, but some reverse in the men's. Like female have like less flexion and extension in hip, but males have more. So that is also a factor affecting for gender range of motion. There is also factor is age. In the adult age, there is a range of motion is higher. During the older age, the range of motion will be reduced time to time due to for the aging. So next thing is nervous system. So upper motor lesion, lower motor lesion, and like cerebellar and basal ganglia paralysis will be reduced, and reduction of the range of motion will be occur. So there is a first part. Next part will be uploaded after some time.